The Ontario Health Coalition is voicing its opposition to the province's plans to open more private clinics for some surgeries. The CBC's Megan Fitzpatrick is at the Ontario Legislature with more on what the Ontario Health Coalition had to say this morning.
The Ontario Health Coalition expressed its concerns about Bill 60 today. This is a bill that was tabled last week here at the Legislature that seeks to expand the role that private for-profit clinics might play in delivering health care in this province. The Ford government is seeking to use these clinics more in order to cut wait times for patients in areas like cataract surgeries and some diagnostic testing like MRIs. But groups like the Ontario Health Coalition are opposed to this move, saying it's yet another step towards privatizing healthcare in Ontario. And they're criticizing Doug Ford's rationale for it in the first place, saying this is not necessary, that the Ford government should be doing more to bolster publicly funded, publicly delivered healthcare in this province. They're also concerned about the existing private clinics that are already in Ontario and where patients, they say, are sometimes pressured to pay extra fees. And the Ontario Health Coalition says there are many examples of violations of the Canada Health Act.
The Canada Health Act was meant to protect patients from exactly these types of fees and this kind of snake oil salesmanship. It should not be like going to a car mechanic when you go into your doctor's office where you're told that there are a range of things that you need and the patient has no idea how to measure the veracity of these claims. That is not what public medicine is supposed to be like in Canada.
At the news conference, several patients shared stories of their recent experiences where they had to pay out of pocket for certain tests associated with procedures they were having done. Mara says that the health ministry is aware that these kinds of violations have been going on and they're not doing enough to crack down. Today, though, we heard a defense of Bill 60 from Premier Doug Ford, who was at a news conference with Prime Minister Justin Trudeau today. He made no apologies for it, saying it's time Ontario starts thinking outside the box, that something different has to be done in order to provide faster access to healthcare for patients who are waiting for it. Here's more of the Premier.
We have to start thinking outside the box. We have to start thinking differently and make bold decisions. But we'll always make sure the safety comes first, and it always will. Make sure there's no different regulations and expedite the process.
Ford said the government will keep looking for new and creative ways for delivering healthcare, and this is all in an effort to clear a massive backlog of surgeries in Ontario. He insists that patients will continue to use their OHIP card, their Ontario Health Insurance Plan card, and not be paying out of pocket with their credit card. Megan Fitzpatrick, CBC News, Toronto.
An Angus Reid Institute poll finds Canadians are split when it comes to for-profit healthcare clinics. 40% say privatization will make the system worse, while 30% are in favor. The remainder are described as curious but hesitant on whether the change would be beneficial. For more on this, we turn to a couple of experts. Dr. Robert Bell is a former Deputy Minister of Health in Ontario and a Professor Emeritus for the Department of Surgery at the University of Toronto. And John Yip is the President and CEO of SE Health, a private, not-for-profit healthcare organization. They both join us from Toronto. Thanks to both of you for joining us. And Dr. Bell, let's start with you. Why do you think that this shift towards privatization is a bad move?
Good afternoon, Diane. Well, I totally agree with the Premier that we need innovation, we need new solutions, but that does not mean by any means that we need for-profit care. For-profit care is inevitably more costly to the taxpayer. And let's face it, people who run for-profit care are predominantly interested in generating profits, as opposed to not-for-profit organizations like the organization that John Yip runs, who are interested in providing the most care possible for a given dollar with the best quality outcomes. That's what we need, is more innovation in the not-for-profit sector.
Okay, so John, let's hear from you. Tell us a bit about what you do and why you think it's a good move if, in fact, the province was going to put more people into private clinics like yours.
Well, thanks for having me, Diane. And I have to agree with Dr. Bell. I think the question is, how can we make our system better? And I think alternative solutions like surgical centers in community settings is one way to do that. But it needs to work within the system, not outside, working in partnership with our hospital partners and addressing their pain points in their local communities. I think also what is not really talked about is about choice and allowing patients to have choice of where they receive their procedures, but it's an equitable choice, is that there's no queue jumping. You can receive your surgery ideally in a hospital setting or in a community setting, and allowing patients to make that decision on their own based on their conversations with their family practitioner and with their surgeon.
But okay, let's talk about this idea, though, that privatization would damage the public system because it would draw some of the professionals perhaps away from the public health care system. Is that something you see happening, Dr. Bell?
Yeah, as an orthopedic surgeon, the biggest risk we have to provision of surgery today is we simply don't have enough nurses who are interested in working in our operating rooms. And it makes no sense whatsoever to draw those nurses who are currently providing not-for-profit care in hospitals away to for-profit centers. Now, the government's recent legislation makes it clear that these community surgery centers, whether they're for-profit or not-for-profit, need to have relationships with hospitals, and they need to have a health human resource plan that demonstrates they're not going to be robbing Peter to pay Paul, as the saying might go, that we need to have a way of ensuring that people who are providing urgent care in hospitals for more complex patients who need more complex surgery will not be lured away by either better pay or better work conditions. We need to have excellent work conditions across all centers in Ontario surgical care.
So, John Yip, where do you find your employees at your private clinic?
Well, I think this conversation has been unidirectional, that hospitals will be losing staff to the community. But in fact, it is a system-wide problem where we are losing many staff in the community to hospitals. So what we need to do is level set and work as a system to plan around health human resource capacity at a local level, at a regional level, and a provincial level. So we are not damaging other parts of the healthcare system by opening up new parts.
So, but again, where do you find your people? I mean, there's only so many healthcare professionals in Canada. And yes, it sounds very innovative to have these new types of care centers. Are there enough staff to be filling the need? John, yeah.
Well, we'll see how many.
Go
ahead, Bob.
Well, Diane, we also need innovation in the way that the excellent people who work in our surgical centers are deployed. There's no question that moving surgery out of hospitals that are resourced for complex care, more care can be provided in the community than it can in hospitals, about 25 to 30% more if we look at the community surgery experience. So that's one of the reasons why the Premier is quite right. We need to innovate by moving surgery to community centers so that these limited surgical human resources can actually provide more care.
So, John Yip, one of the things that the Ontario Health Coalition was talking about this morning was the idea of upselling, that patients could get into some of these clinics and be told, you know what, you could have these other procedures while you're here at, of course, for additional cost. What's your view of that?
Well, I think this is a conversation between the patient and their surgeon. Within ophthalmology, it's been talked about, and it's quite true that there are lenses that are not covered by the government fee schedule. Outside of ophthalmology, I think there are very limited opportunities to upsell. And if they are between the patient and a surgeon based on the best clinical information and clinical decision between those two parties.
And Dr. Bell, do you think there are elements of for-profit care that could be justified under the Canada Health Act?
There's a lot of for-profit care that exists in the Canadian health system already. For example, pharmacists operate for-profit businesses. most physicians are operating small businesses, and as they develop their services for patients, there's lots of profit. 32% of Canadian healthcare is provided through private, quote, insurance or out-of-pocket funding, Diane. But I think the concept that medically necessary care, especially that associated with physician care and hospital care, should be funded from the public purse without for-profit delivery that inevitably increases costs, is something that we need to honor. It's part of our culture and it's part of our healthcare delivery process under the Canada Health Act.
So, John Yip, where do you see this going in terms of people understanding better how this is all going to work together? Because as we saw in that survey from Angus Reid, there's a lot of different opinions here. How do you think it should move forward? What's the next step?
Well, I think Bill 60 was a first step, but the details are to come. And one of the elements I'm very interested in is the role of government and government oversight to address some of the issues you've raised, Diane, around upcharging and ensuring the best clinical care is delivered in all aspects of our healthcare system, whether they be hospital-based or community-based. And so we'll see in the regulations what powers or guardrails the government will put in to ensure that all Ontarians receive the care they need.
All right. Well, thanks to both of you for joining us today. We appreciate it. Dr. Robert Bell and John Yip. They both